Dr. Grimes?
All right. Good afternoon, everyone. It's nice to see everybody rolling in here. I see that the participant numbers are going up, and which is exciting.
It's very exciting. We're expecting around 400, Chris.
Wow.
Yeah, so we may want to give a few more seconds as that
Yeah,
number is
let's do
growing
that.
to around 250 right now.
Let's do that.
Thank you all so much for joining us for this RFA webinar. We're very pleased to have you here.
We'll give it just a couple more minutes here. I'm going to give everybody an opportunity. Hopefully everybody has been able to dodge most of the severe weather. Good.
We will be using the question and answer feature during today's webinar. So please feel free when you have any questions for all of our presenters to put them in that Q&A box. That's where we'll be looking for them and responding to them. Thank you.
All right. I see the speed of our participant number is slowing. So if that's okay, panelists, are we square to go? Okay. All right, we're going to go ahead. Well, good afternoon. It is good to see so many of you all and see your interest in the GusNIP Produce Prescription Program and this webinar. And we are excited to be presenting that information to you. We do want to welcome you to the Gus Schumacher Nutrition Incentive Program, or GusNIP Produce Prescription Program, the FY RFA Technical Assistance webinar. My name is Chris Grimes. I am a new national program leader with the National Institute for Food and Agriculture. I'm in the Division of Nutrition in the Institute for Food Safety and Nutrition of the USDA. It'd be 5 months next week, and so it's been a tremendous time working with all the NIFA staff, as well as all the stakeholders and individuals like yourself. We are more than excited to have you all on board for this webinar, to be able to walk you through the RFA. We do want to remind you that while this is this webinar is for technical assistance and to go over the RFA, we want to remind you how important it is to actually read through that RFA multiple times so that you're very well versed in that. And with that said, I am going to hand this over to Jamilis, one of our program specialists, and she is going to take it from there.
Thank you, Dr. Grimes. And before we get started, we would like to cover a few housekeeping notes. First, to access interpretation service, click the interpretation icon of a globe and then select the language. Los asistentes hispanohablantes, para acceder al canal en español y obtener el servicio de interpretación simultánea, hagan clic en el icono del globo terráqueo que se encuentra en la barra de herramientas en la parte inferior de la pantalla y seleccione el idioma español. If you are having any issues with the audio or visuals today, please contact Zoom Tech support. All participants should be muted. If you have any questions throughout the session for Presenters, please type them in the Q&A. We will be answering questions related. We will be answering questions related to the presentation content via the Q&A. This webinar will be recorded. A link to the recording and the slides will be available on the GusNIP Produce Prescription Program Funding Opportunity page, where you downloaded the RFA, and I will be sharing in the chat right now that link. This is our non-discrimination statement. Sorry. In accordance with federal civil rights law and the United States Department of Agriculture, civil rights regulation and policies, the USDA, its agencies, offices, and employees and institutions participating in the administrating USDA programs are prohibited from discriminating based on race, color, nation, origin, religion, sex, gender, identity, including gender expression, sexual orientation, disability, age, marital status, family or parental status, income derived from public assistance program, political beliefs, or reprisal or retaliation for prior civil rights activities in any program or activity conducted or funded by USDA. Not all bases apply to all programs. Remedies are complaint filing deadlines vary per program and incident. Any incident of discrimination during this process, if you feel that you have been discriminated, please, you are welcome to use the information in this slide to contact and file a complaint. And I'm going to share also the link for everyone. And right now, I'm going to present our team for the GusNIP portfolio. First, we start with our Deputy Director of the Institute of Food Safety and Nutrition, Susan Sluka. Then we have the Director of the Division of Nutrition, Shannon Perillo. Myself I am Jamilis Ocasio, and I'm a program specialist for this program. And next, I'm going to let Dr. Kennings come out of mute and on camera so she can present herself.
Thank you very much, Jamilis. My name is Mallory Koenings. I am one of the national program leaders for the GusNIP Produce Prescription Program. And I will have Dr. Chris Grimes, who is my co-national program lead, introduce himself next. Thank you all so much for your interest in this program and for being here today. And
Dr.
since you've
Grimes
already
did
heard,
present
yeah,
himself.
yeah.
Yes.
Since
We can move to Ryan.
move to Ryan. Yes, thank you.
Greetings, everyone. Good afternoon. I'm Ryan Cornegay. I'm a program specialist in the Institute of Food Safety and Nutrition, helping out here with the GusNIP program. I'm excited to share with you all today in the webinar and looking forward to sharing information with you all. And I'm going to pass it over to our AMD colleagues, and I'll start off with Beth.
Good afternoon, good morning, welcome. I'm Beth Curling. I'm a Senior Grants Management Specialist in NIFA's Awards Management Division. I'm here in support today of Maria, who you'll hear from with a lot of great information on how to navigate awards management. So, Maria?
Hi, everyone. My name is Maria Crespo-Sijimpo, and as Beth mentioned, I'm a grants management specialist in the awards management division, and I look forward to speaking with you all today and presenting some information later. Thank you.
We can move to the NTAE team.
Hi, everybody. My name is Rachel Ho. I'm with Fair Food Network. We are the co-leads of the NTAE and the Nutrition Incentive Hub. You'll learn more about the services that we offer for the consultation sessions, for your required consultations for your application, and as well the resources that we have in support of your application later in this presentation. So I'm looking forward to meeting a lot of you one-on-one and sharing more about the services that we offer later on in the presentation.
Hi, everybody. Holly Ann Fricke. I'm an associate scientist at the Gretchen Swanson Center for Nutrition, based in Omaha, Nebraska, and you'll hear from me a little bit more later as well. I'll pass it over to Melissa.
Hi, everyone. My name is Romley Levi. I'm with the University of California, San Francisco team, and we provide produce prescription advising services. So providing advising services on implementation and evaluation support. Look forward to talking to you all later in the presentation.
Well, thank you everyone for presenting yourselves. This is the contact information for the GusNIP team portfolio. We have for the programs tab, the general FNS GusNIP team, the grants management staff, and the NTAE. Remember that this information, you will have it available through the slides and the recording once we completed this webinar. And I'm going to pass it to Ryan.
Thank you, Yamilis. So as we get ready to go into our webinar today, just to kind of share with you all some of the topics that we will be covering, I want to give you this quick overview. So during today's webinar, we will be covering the following topics. First, we'll provide an overview of NIFA, the Produce Prescription Program, and important details from the RFA and the program evaluation process. Then we'll have our partners from the NTAE team who will provide additional information and resources to you all. After that, we'll have some time for questions towards the end of our presentation. Next slide, please. And so as we get ready to go through this presentation, and if you've taken a look at the RFA or are familiar with the program, you know that there are a number of acronyms and initialisms that are a part of the GusNIP program. And so before we get started, we want to just kind of go through a few of those so that you all could be familiar with them. So as far as our acronyms, of course, GusNIP stands for the Gus Schumacher Nutrition Incentive Program. SNAP, of course, stands for the Supplemental Nutrition Assistance Program. And then for our initialisms in the GusNIP program, when we say PPR, we are talking about the Produce Prescription Program itself. If you hear us reference the NTAE, that is referencing the Nutrition Incentive Program, Training, Technical Assistance, Evaluation, and Information Centers. And lastly, if you hear us share about IRB, that is concerning the Institutional Review Board. Next slide, please. So let's go through a quick overview of the NIFA program. In this section, I'll provide a general information about the National Institute of Food and Agriculture. So what exactly is NIFA? We are the lead federal agency that provides extramural funding for food and agricultural sciences. We were created through the Food Conservation and Energy Act of 2008, and we invest in and support initiatives that ensure the long-term viability of agriculture. In addition, NIFA actually also provides funding and strategic leadership for programs that ensure groundbreaking discoveries in agricultural related sciences and in technologies. Next slide, please. And to give you more of a broad view of just exactly what type of projects and what type of areas NIFA is engaged in, here is a list of the topics covered by all of the National Institute of Food and Agriculture programs. The GusNIP portfolio itself falls under the food and nutrition security topic. Now I will pass the presentation on as we continue on with this presentation and have Dr. Canans come and share with us about the program overview for the Produce Prescription Program. Dr. Canans.
Thank you very much, Ryan. Next slide, please. I'm hopeful that this section of the presentation will answer many clarifying questions around the core elements that need to be present in a proposal to the Produce Prescription Program, or PPR, as Ryan mentioned, and as you'll see on this slide. For those of you who may already be aware of the Produce Prescription Program, we're beginning with some notable new elements in the 2024 Request for Applications, or RFA. One key clarification that you'll hear more about later is the required annual attendance at NIFA's project director meeting. Please make sure that when you're preparing your budgets for your proposals, that you're adequately providing support for the project director to meet this annual requirement. We want everyone to be aware of the total maximum budget request for these proposals, right? And that amount is $500,000. So it is not possible to request $500,001, right? The total maximum budget request, no matter how many years of a duration of project you may be proposing, is $500,000. Many of you are familiar with our eligible institutions, right? Our eligible entities being governmental agencies and nonprofit organizations. There are some institutions of higher education that are governmental agencies. And if you are from one of those organizations, please be aware that you need to provide clear documentation that your institution of higher education is part of some sort of governmental entity, right? Whether it's part of the Department of Education or Department of Public Health, that documentation needs to be provided. You are strongly encouraged to share with NIFA program staff what that documentation is, so that early in this process, we can have our colleagues who are policy experts review that documentation and get back to you with a determination of eligibility. We want to make sure that we do this to be respectful of your time. Once a determination has been made, it is essential, if you are an institute of higher education, that that documentation be attached to the grant application. And you'll see here that that gets attached in field 12 in the grants.gov portal. We also want to highlight for everyone that as you're working with your project team, it's critical to make sure that you and other team members are making it clear how there will not be any sales tax, right, collected on the produce prescriptions when they are redeemed. And varying project designs, this might be something that is best in a letter of support or best in a project narrative. What is critical is that how your project teams are going to ensure that no sales tax is collected on these produce prescriptions when they're redeemed, that is documented in the grant application. Next slide, please. Okay. This program, as many of you are aware, is an excellent opportunity for the food system and the healthcare system to work seamlessly and collaboratively. The ultimate goal is to improve the nutrition and health status of the participants in these produce prescription projects. All of these projects must prescribe fresh fruits and vegetables to the eligible participants. The definition, right, of fresh fruits and vegetables is shown here. It's also provided in the request for applications. These are any variety of fresh, whole, or cut fruits and vegetables, and they should be, right, culturally relevant and culturally affirming fruits and vegetables, right, fresh fruits and vegetables. Next slide, please. There are 3 goals of the GusNIP Produce Prescription Program, and proposals must, right, address all 3 and capture a change in all 3 of these areas. Okay, so going through the list here, that is overall, right, dietary pattern, including increased consumption of fruits and vegetables, change in individual and household food insecurity, and change in healthcare use and associated costs. As you've heard, we have our colleagues from the GusNIP Training, Technical Assistance, Evaluation, and Information Centers here, or what we call the NTAE for short. They will describe for you what is included in the core metrics, right, for capturing change of these 3 program goals. So more on that later. Next, please. This request for applications does include prioritizing projects that serve underrepresented communities and underrepresented geographies. Please pay specific attention to the geographies listed in the RFA. These are updated every year based on the geographies that have an active produce prescription awardee currently. You'll see in the underrepresented communities that there are, right, many opportunities here to include communities that historically have been underinvested in. So we're very hopeful and proud of the progress that we've made in this area, and excited to continue the work in this portfolio serving underrepresented communities and underrepresented geographies. Next, please. The organizations that may be primary applicants to the Produce Prescription Program are nonprofit organizations and governmental agencies. And we do have two details that we want to share with you all. If you are with a Veterans Health Administration hospital or clinic, right, a VA hospital or clinic, these hospitals and clinics are defined as, right, part of the federal government. They meet eligibility as a government agency to be a primary applicant. And as we clarified in the updates for this year. We want any institution of higher education, right, that is a governmental agency to be aware of the need to provide that documentation of eligibility in the grant application in field 12. So those are the two keynotes here. Let's go to the next slide, please. All applicants need to work with a healthcare partner. This is a requirement of the program. There are 4 types of healthcare partners that are shown on this slide, right? A hospital, a federally qualified health center, a hospital or clinic, right? Operated by the Secretary for Veterans Affairs, or a healthcare provider group, right? So a healthcare partner that meets one of these 4, right, possible definitions is what's needed. We do commonly get asked, since you saw, right, that VA hospitals and clinics are eligible as primary applicants as well as healthcare partners. Would it be possible for one organization, right, let's say one VA hospital, to fill both roles? The answer is yes, right? A single VA hospital could fill both the role of the healthcare partner and the role of the primary applicant. It is essential that the healthcare partner provide a letter of support for the grant application. So even in the case of a primary applicant, right, a VA hospital serving in both roles, that grant application must still have a letter of support, right, from the healthcare partner as a required application document. So please be sure everyone who provides their application that you have that letter of support from your healthcare partner and that you attach that to your application. Next slide, please. This is reinforcing, right, in the cases, right, where the primary applicant, right, nonprofit or governmental agency may also be one of those 4 types of healthcare partner, right? Might be, maybe it's a nonprofit organization that is a nonprofit hospital, right? The VA is not the only example, but that, of course, everyone, whether they're fulfilling both roles or only one role, must have that required letter of support from a healthcare partner in their grant application. Some of the key elements for the produce prescription proposal. There will be many times throughout the proposal where you'll need to write down the name of the grant program, right? Produce Prescription Program, or give the program code as you're applying. That program code is PPR. We're lifting up here again that the maximum budget is $500,000. The project duration is flexible, that it can be in 12-month increments, right? 1 year, 2 years, or 3 years. That is up to you and your project team who apply to determine that. No matter the project duration, or what we will sometimes call the project period, that maximum budget remains the same. All right, so please be mindful if you want to propose a 2-year project, the maximum budget is $500,000. If you want to propose a 3-year project, the maximum budget remains $500,000. And we're also reinforcing here that all proposals must prescribe fresh fruits and vegetables. That prescription, to clarify for everyone, right, that needs to be, that dosage and duration of that prescription needs to be determined in consultation, right, with the healthcare partner. That can, the particular healthcare provider that writes that prescription can be flexible within the healthcare partner, right? The healthcare partner organization's framework. So maybe it is a primary care provider, maybe it is a registered dietitian. That needs to be, you know, agreed upon and determined by the healthcare partner. Also, all proposals need to address the 3 goals of the Produce Prescription Program, right? Which means evaluating or you know, capturing change in fruit and vegetable intake, right? Overall dietary consumption, food insecurity, and then change in healthcare use and associated costs as well. All 3 of those items. Next, please. So there are also 3 approaches, and one of them, right, at least one of them needs to be included in the grant application. So you'll see here that the proposal might include providing a financial or non-financial incentive to eligible individuals to procure fresh fruits and vegetables. Could be providing educational resources on nutrition, could be establishing additional locations, right, to access and fill those fresh fruit and vegetable prescriptions. I will share with you all that the most competitive proposals to this grant program are those that are consistent, right, with everything we have learned in the produce prescription field. It is extremely common, right, for some type of nutrition education to be proposed as a component of a produce prescription project, whether that type of nutrition education is through individual medical nutrition therapy counseling by a registered dietitian nutritionist, or perhaps, right, leveraging existing federal nutrition education programs or evidence-based nutrition education curricula that, right, are available and validated for the field. Those are all components that we do see. Providing, right, additional access locations to improve the overall, right, food environment for fresh fruits and vegetables is something, right, you all could include in your grant application and might consider, as well as, you know, if there are any educational, right, non-financial educational extenders that might best benefit your community, right, your participants, or if there are, right, other financial benefit opportunities like federal food assistance programs, right, things like the Supplemental Nutrition Assistance Program, SNAP, or the Special Supplemental Nutrition Assistance Program for Women, Infants, and Children, WIC. Those are all various things that you and your project teams might consider. We do commonly see that the most competitive proposals are utilizing the community assets, right, and community voice to determine what elements, right, are going to be included in the project and in the total package of that, right, produce prescription, dosage duration, and intervention, right? You can think of these elements as part of that produce prescription intervention. Next, please. All right, you've heard us say participants and you've heard us say eligible individuals many times so far. in this program, there is a specific definition, right, for who the participants may be, right, who the eligible individuals are to participate. And I'm going to describe that for you now. What is essential is that anyone who is eligible to participate needs to be either currently managing a diet-related health condition or at risk of developing one. And then one of the two other conditions listed here, right? So there are two steps, the diet-related health condition eligibility step, and then one of these income eligibility steps. So one might be being eligible for benefits under the act shown, and that's the Supplemental Nutrition Assistance Program Act, that's SNAP, or enrolled in Title 19 medical assistance is what's shown here, and that's Medicaid. That's the Medicaid or CHIP medical assistance plan. Okay, and you'll see that can be the primary plan or enrollment in a waiver of a plan. So if there's additional questions on that, well, we're happy to answer them at the end. But those are the two steps for who might be served by these projects. Next slide, please. Okay, here are the key components on this slide of what information needs to be in the healthcare partner letter of support. And remember, right, there's 4 different types, right, of healthcare partner. Any one of those types may be included in your grant application, and right, everyone needs to include this letter of support from the healthcare partner. So this letter of support from the healthcare partner, right, it needs to contain exactly what that healthcare partner organization is going to do in support of the proposed project. If your healthcare partner is going to be referring any potential participants or screening any potential participants for the project, right? If they're going to be, writing those produce prescriptions for the projects, if any of the healthcare outcomes or healthcare use and associated cost outcomes that may be part of your evaluation are going to come from the electronic medical record, that needs to be included, right? If the educational opportunity is going to be something offered by the healthcare partner, right? If this is a diabetes prevention program, diabetes self-management program, if it's consultations, right, whether group or individual with a registered dietitian nutritionist, whatever it may be, that needs to be in there. If they're going to have any role in communicating where the prescriptions can be redeemed, if they're going to be collecting any of the core metrics that we'll hear more about from our NTAE partners, and if they're going to be doing having a role as also your evaluation partner in part, right, or in totality when it comes to the 3 goals of the Produce Prescription Program. All of that needs to be in the letter of support. If the healthcare partner is going to be the location where the produce prescription is redeemed, please also note that this letter should address, right, wherever that produce prescription is going to be redeemed, that letter of support needs to address how sales tax will not be collected on redeeming the fresh fruit and vegetable prescription. Next slide, please. You've heard that we have the support of the GusNIP NTAE for all applicants to this program. This is an opportunity free of charge to be part of group sessions, webinars, even one-on-one support to go over common mistakes that applicants might make. And this is typically a 1 hour group session, right? 1 hour support session. And after that is completed, the NTAE will go through and show you where their form is, right, for you as an applicant, right, to request the letter of verification from them that you've completed this consultation, and then attach that to the grant application. So please note, right, when the NTAE is presenting, they will share where you can find out about all of these opportunities, right? And where you can fill out that form to request the letter of verification that you've completed it, and then upload that to your grant application. Next, please. Thank you very much. What we're clarifying here is that the Produce Prescription Program does have a required comprehensive evaluation. So these are the minimum requirements, right? The core metrics that all produce prescription projects across the country collect. Every produce prescription grantee must participate and collect these core firm level and participant level metrics. The NTAE will go into detail on this. The NTAE also collects all of these metrics from participants and then aggregates them into the national sample and overall national GusNIP impact findings. So collaborating with the NTAE on utilizing these core metrics and contributing a subsample, right, to that national data set are requirements of this program. I will share that you all may design your overall evaluation plan to go above and beyond this. If there are additional items that you want to evaluate, additional levels of sophistication that you would like to add to your project, you have full flexibility to do that. So long as you are collecting, right, the core minimum data set. Also, please know that for successful applicants, after awards are made, the NTAE will work with everyone to determine the subsample size for the core metrics. You are most welcome to have all of your participants complete the core metrics. However, the requirement is for it to be a subsample, and more details on that will be provided by our NTAE colleagues later. And with that, I'm going to go ahead and turn the presentation over to Ryan Cornegie.
Thank you, Dr. Canines. Now we're going to take a moment to go over the application details and documents that will be required in your application. Next slide, please. So when we're talking about your application submission, just to go over some information I'd like to share before we continue, we want to remind everyone that is interested to apply for this program that you make sure you read the RFA because this webinar will share the core information in the RFA, but there is no substitute for the RFA itself. The RFA should be considered the primary reference document for this funding opportunity. And as an applicant, please make sure that you ensure that you have carefully read the RFA before beginning the application. And so as we switch gears here and talk about application details, we want to make sure that we help you to understand what this looks like on the side of NIFA. So applicants must apply to this RFA electronically. No other method or response is accepted. The Part 3 of the NIFA Grants Application Guide contains detailed information regarding the grants.gov registration process. When applying for a NIFA award, it is important to reference the version of the guide that is included in the specific funding opportunity application package. Application documents must be in PDF format to be accepted by NIFA, including your narrative and budget justifications. NIFA does not allow other formats outside of PDF, even if they are accepted through grants.gov. And if grants.gov allows it, we are unfortunately unable to receive any documents that are not in PDF format. So please make sure that you have any documents that you submit to us through your application in PDF format. We also recommend that you do not use any third-party PDF builders. Next slide, please. So please note the application details listed here below. The project narrative, which has a page limit of 15 pages, will be strictly enforced. Appendices to the project narrative are allowed if they are directly useful to the proposed project. Do not add appendices to sidestep the page limit, however, towards your narrative. It is important to include the bibliography and references cited for the information that you are sharing in your application. The logic model also should be no more than 1 page. And when we share about the business plan should provide evidence, for example, a market analysis or the outline of a management plan to demonstrate how sustainability of the project will be achieved. If it is necessary to include a fiscal agent letter, then please make sure you title that attachment as fiscal agent in the document header and save the file as fiscal agent. We ask that you please include documentations of the applicant organization's nonprofit status as well. The data management plan should be no more than 2 pages itself. And regarding letters of support from the required healthcare partner and the GusNIP NTAE Center, these should be no more than 2 pages from each organization. Institutions of higher education that are local, county, tribal, territory, or state government agencies must provide documentation in support of the eligibility as a governmental agency in field 12 of the grant application. Documentation must clearly identify that the university or cooperative extension is designated as an entity within the governmental agency structure, such as the Department of Agriculture, Department of Education, or the Department of Health. Any institution of higher education that is interested in applying is strongly encouraged to contact NIFA for an eligibility determination prior to preparing an application. Please remember to document in the project narrative and/or letter of support from the appropriate partner or organization that no state, territory, or local tax is collected when produce prescriptions are redeemed. Next slide, please. Now, regarding the project narrative. When writing the project narrative, please make sure that the following are included. You should have an introduction to the communities involved in the project and the benefit to the community or communities involved. Personnel and resources of the organization and communities involved in the project should also be included. The project goals, intended outcomes, and relationship to GusNIP's Produce Prescription Program purposes and priorities should also be included. Activities to achieve the goals should also be included, and an evaluation plan, which must include the GusNIP Comprehensive Program evaluation core participant level and firm level metrics should also be included in this narrative. A sustainability plan should also be included, and no supplementation, meaning the proposed project must not replace current activities. It must be new, expanded, or enhanced projects. And we ask you please review pages 18 through 22 of the RFA for additional information. Next slide, please. Now I'm going to turn it over to Yamilis to share with us about the program evaluation process.
Thank you, Ryan. Now I will be talking about the application, the proposal evaluation process. NIFA serves the right to negotiate with the project director and or the submitting organization or institution regarding project revision, for example, changes in the scope of work, adherence of a SNAP policy, funding level, period or method or support, prior to recommending any project for funding. As part of the evaluation process, initial screening for eligible organization, page length requirements or required forms, and all files in PDF. Budget must be and within the dollar ceiling letters of support from healthcare partners and GusNIP NTAE Center, and demonstrate capacity and willingness to participate in the comprehensive program evaluation requirements with the NTAE Center. Peer review using the program area evaluation criteria. If the applicant has received USDA grants awards in the past, then the history of compliance with grant requirements will also be considered. These include NIFA reporting requirements, such as annual report, technical reports, financial reports, and SF 425 federal financial reports. First, the reviewer, and this is a little bit of the peer review process. First, the reviewer summarizes how well the application addressed each evaluation criteria. After the application has been assessed for strengths and weaknesses of each criterion, the reviewers then evaluate the overall likelihood that the project will have significant outcome and impact. These written reviews are used to begin a panel discussion with other reviewers serving on the peer review panel. Through these discussions, peer review panelists come to consensus on the final rating and ranking of each one of the proposals. For the evaluation criteria, NIFA will prioritize the following types of projects for award in accordance with the program area evaluation criteria serve underrepresented communities, such as tribal communities and or serve underrepresented geography, such as Alabama, American Samoa, Arizona, Commonwealth of Northern Mariana Islands, Delaware, Federated States of Micronesia, Guam, Idaho, Kansas, Maine, Maryland, Nebraska, New Hampshire, North Dakota, Puerto Rico, Rhode Island, U.S. Virgin Islands, Utah, Vermont, Wisconsin, and Wyoming. Although priority is given to projects serving underrepresented community or underrepresented geographies, all applications that meet the initial screening criteria in the RFA will be considered for funding. When preparing your project narrative, please clearly describe the alignment between the community that will be served by the Produce Prescription Project and the priority underrepresented community. Evaluation criteria also includes the community benefits, the project goals, objectives, and intended outcomes, the qualifications of organizations involved in the project, the evaluation, the sustainability, and the time and budget. Based on past couple of years of application submission, listed here are the common mistakes that resulted from in an administrative declines. So here are the common mistakes for you to avoid. Make sure to meet the format requirements, the page length and PDF format, and you will hear it over and over again. It's very, very important that all documents need to be in PDF format. Make sure to complete and submit the following documents: the budget justification, the NTAE consultation letter of support, the healthcare partner letter of support, the bibliography, current and pending. This is a support document, but highly important, and the conflict of interest. Submit proof of eligibility for the IHE applicants. Review that the budget is within the maximum award amount. And be attentive to the due date. The late submissions represent an automatic decline. Please note the timeline of the competitive program. Funding notifications typically take 6 months after the application due date. We will keep you updated as much as possible, and we really, really appreciate your patience. NIFA welcomes the assistance, ensuring our peer review panel have the required expertise while remaining inclusive, representative, and diverse. Interested individuals who are not applying to this funding opportunity may volunteer to serve on the peer review panels by providing their contact information and expertise. And I'm going to share the link in the chat for everyone to see it. Now I will pass it to Maria from our awards management department, who will provide information about the administrative requirements.
So next, yes, I will be covering the administrative requirements, and this will include pre-award requirements, cost share or matching, budget and justification, indirect cost recovery, and sub-award restriction. Next slide. So for certification of lobbying, submission of application in grants.gov includes certification of compliance to disclose lobbying activities. In the event lobbying activity applies, an SFLLL disclosure of lobbying activities form is required. The disclosure of lobbying activities form can be viewed via the link that will be posted in the chat shortly. Next slide. So for organizational management information, prior to award, applicants must verify or re-verify financial management and internal controls in accordance with NIFA policy and Uniform Guidance 2 CFR, Code of Federal Regulations 200.302 and 200.303. A current single audit fulfills this requirement. Example documents when a single audit is unavailable include 2 years of audited financial reports or certified year-end balance sheets, details of your cost accounting system, auditing arrangements, and salary compensation, a list of current or recent federal awards, and statement of purposes and powers such as bylaws. Next slide. So only one GusNIP Produce Prescription Program application per applicant organization is allowed. Therefore, duplicate or multiple submissions are not allowed. NIFA will accept the last application received and disqualify previously submitted applications if an applicant submits duplicate or multiple submissions meeting the application deadline. Next slide. So for cost share and matching, this particular program for produce prescription, there is no matching requirement that is required. And so therefore, NIFA will not factor matching resources into the review process. And so I'm going to speak a little bit more about this when we get into the budget. Next slide. So for the budget and justification, this includes the research and related budget, federal only. So again, match is not required. A separate budget justification is required. And within that budget justification, it should reflect the funds requested within the budget itself. And it should also provide an explanation of the funds that are requested in each budget category. If costs are deemed unallowable during the review process, they must be replaced during the award review. So in other words, those costs may need to be reallocated to different budget categories. Next slide. So what's new this year in FY 2024? Please be aware that within Field D, this is where you would find domestic travel. And during the tenure of a grant, PDs or project directors must attend a PD meeting each year, as was previously mentioned earlier. Additionally, total fruit and vegetable prescription dollars must be summarized in the budget justification with clear affirmation of which budget category or categories were used to calculate totals. So for example, a project design may necessitate produce prescriptions are included in section F.8, other direct costs, and section F.5, subawards / contractual costs. However, the budget justification should clearly describe that total fresh fruit and vegetable prescriptions are a sum of F.8 and the portion of F.5 specified as produce prescriptions. Next slide. So for indirect cost recovery, GusNIP allows for full recovery of indirect costs based on the current negotiated rate established by the cognizant federal agency. So if there's no negotiated rate, you may, 1, request negotiation from your cognizant agency, 2, use the 10% modified total direct cost, also known as the de minimis rate, or 3, waive indirect cost recovery. And for more information on the indirect cost process and allowable scenarios, you may refer to the link that will be posted in the chat. Next slide. So for the 10% de minimis rate, an entity that does not have a current NICRA or provisional rate and does not want to negotiate indirect costs may be eligible to elect a de minimis rate of 10% of modified total direct costs as defined in 2 CFR 200.414F. Please note that once elected, the rate must be used consistently for all federal awards until the entity chooses to negotiate a rate, which the entity may request at any time. And again, that information can be found in the indirect cost link that was posted. Next slide. So for subaward restriction, no more than 33% of the project as determined by budget expenditures may be subawarded without NIFA pre-approval. If pre-approval is desired, please contact the national program leader that oversees this program. Next slide. So the following resources for applicants will be posted in the chat to include frequently asked questions, application resources, RFA webinars, and the website for the Nutrition Incentive Hub. Next slide. In addition, these links will be posted in the chat. So this will include the funding opportunity page, competitive grants flowchart, NIFA grant resources, NIFA policy guide, indirect costs, a guide for preparation and submission of NIFA applications via grants.gov, and information on awarded grants. Next, I would like to pass this forward to our NTAE speakers. So thank you for your time.
Alrighty, hello everybody. My name is Rachel Ho. I am the Senior Manager of Nutrition Incentives here at Fair Food Network based in Detroit, Michigan. And I'm going to tell you about the NTAE, our services, and then we'll get into more about how to get your required letter of verification from the NTAE. So next slide, please. For those of you that are new to the Nutrition Incentive Hub, we are a coalition of partners created by the Nutrition Incentive Program Training, Technical Assistance Evaluation, and Information Center. So that's what NTAE stands for. And our role is to support the GusNIP grantees, applicants, and other GusNIP audiences in preparing your applications, running your programs. We work with produce prescription projects and nutrition incentive projects across the country and make connections between these programs and help them apply and administer GusNIP grants. So our objective overall is to strengthen access to fruits and vegetables with a goal of making safe, nutritious food available to all Americans. And the GusNIP, the NTAE, and the Nutrition Incentive Hub are funded through the 2018 Farm Bill, and this program was formerly known as FINI. So some of you may know the FINI program, and it was renamed GusNIP. So next slide, please. So who, and what is the NTAE and the Nutrition Incentive Hub? So the GusNIP NTAE Center is led by the Gretchen Swanson Center for Nutrition. You'll hear from some folks from later. They are in a cooperative agreement with USDA NIFA to oversee the GusNIP NTAE Center. And you'll see these three arrows below here. The GusNIP NTAE Center oversees the Nutrition Incentive Hub, which is co-led by the Gretchen Swanson Center for Nutrition, who leads reporting and evaluation related work, the University of California in San Francisco, which leads produce prescription services, and my team here at Fair Food Network, which leads technical assistance and innovation and program administration related work. We also work with three fabulous partners from around the country who come with topical expertise, including the Michigan Farmers Market Association, who specializes in farmers markets, farm direct programming, and produce prescriptions, the Food Trust, who we work really closely with on corner stores and nutrition education, and then the National Grocers Association Foundation, who we partner with for brick and mortar retail. And this is, when you talk to one of us here at the Nutrition Incentive Hub, just know that this is the whole team behind us. So it's truly a brain trust of people helping you out with your questions. Next slide, please. So while you are all here because you're interested in the GusNIP Produce Prescription RFA. So the Nutrition Incentive Hub, we support a wide variety of your needs around your GusNIP application. So we're here to help you with project planning and ideation, interpreting the GusNIP RFA, understanding what certain passages mean, the requirements. As you see, we specialize in evaluation. So especially with this produce prescription grant, evaluation is a large part of what you're being asked to do should you receive a GusNIP grant. We can also support you with SNAP and NAP if you're in Puerto Rico, policy questions. So understanding equal treatment around SNAP and NAP shoppers. And then we can do high level application and administrative review. So helping you understand how do you apply for GusNIP using grants.gov, some of the administrative concerns that the NIFA team mentioned earlier, which are reasons why applications don't make it to review. We're here to support you with all those types of questions. So next slide, please. Great. So as you know, on page 11 of the RFA, there is a requirement that you have a 1-hour consultation with the GusNIP NTAE Center for free, and we like to emphasize free one-on-one support, and to review general pitfalls with applying for GusNIP. And you also are required to get a letter of support from the NTAE to attach to your application in field 12. So the next slide, I'll tell you a little bit more about how to do each of those steps. So next slide, please. Great. So in order to get your letter of support or verification from the NTAE, it requires all applicants to have a consultation of about 1 hour with the GusNIP NTAE's Nutrition Incentive Hub. And this can be met in 2 ways, either by doing a one-on-one session or a group support session. And just so you know, this webinar today does not count towards your required 1 hour consultation. You need to do something separate. You need to meet with the GusNIP NTAE in a location other than this webinar. So next slide, please. So great. How do you schedule your consultation? You're all asking. You can do one of 2 things. So my teammate is going to put in the chat. Great. Thank you. You'll see a link in the chat right now, a TFA forms link. What this is that we ask you a few questions before we schedule your consultation around if you've applied for a GusNIP Produce Prescription Grant before, if you've run a Produce Prescription Grant overall, and then also what is your level of familiarity with running an evaluation. So based on the answers to those 3 questions, we make a suggestion for you on what type of consultation would be best for you. So if you are newer to if you've never applied for GusNIP, you've never run a Produce Prescription project before, are not very familiar with an evaluation of this scale, we're going to recommend that you do a one-on-one consultation. If you are experienced with Produce Prescription Grants, you've run a Produce Prescription Grant before through GusNIP and some other factors, we'll recommend that you attend a group session. So please fill out that form. It gives you a little bit more information. And then once you give us some answers, it'll send you to a page, a Calendly scheduling page, where you'll schedule your consultation. So make sure 1, you fill out that whole form, 2, you go and schedule your consultation through that. If you don't feel like, if you forget this link and want to schedule afterwards, you can email us at ta@nutritionincentivehub.org and we can resend you this link. And that's also the email for just general questions you might have about the RFA. But to reiterate that you as the applicant need to request this consultation. We are not going to reach out to you asking if you have. You are responsible for requesting the consultation. And then next slide, please. You are also responsible for requesting the letter of verification. So what will happen is once you've scheduled your consultation, once you have the 1 hour meeting at the NTAE, at the end of that meeting, we will give you another link to fill out to request your letter of verification. And then on a weekly basis, we will send you a letter that you attach to field 12 of your application saying, yes, this organization met with us on this date. They're applying to Produce Prescription. So just to reiterate, your application will not pass NIFA's administrative review if you do not include the letter of support. So to reiterate one more time, please schedule your consultation. Please come to your consultation, stay for the full hour, request your letter of verification, and attach the letter of verification that you receive to your application in field 12. So next slide, please. Great. And there are other opportunities to learn about the GusNIP application and some frequently asked questions that people have. So we'll also share these links in the chat. We have many, many templates and guides for you to use when you're preparing your application, from budgeting to evaluation. We get a lot of questions about the logic model. So there's templates and resources about that. We also we're going to start offering weekly topical support sessions. So that by that we mean we're going to offer sessions about webinars, frequently asked questions that people have had in the past. So working with grocers, starting a CSA program, technology, just many topics that we've seen people ask a lot of questions about in the past. Those are also offerings. So please, we'll include this link in the follow-up email to you all, but please make sure to check out these resources and links if you haven't already. Next slide, please. And then finally, outside of the RFA, a great way to find out about what offerings that we have for RFA support is through our newsletter. So once you get these slides, the link to our newsletter will be there. We also have a discussion board, other events and webinars. hosted by the NTAE, the Nutrition Incentive Hub. So even as you are applying, just there are great opportunities to get to know other programs across the country that are running nutrition incentive programs, and yeah, learn a little bit more about what's happening in this field. And always, if you have any questions about anything I just mentioned today, you can email us at ta@nutritionincentiveHub.org. Next slide, please. Great, so now I'm going to pass this on to my teammate, Ron Lee. Thank you, everybody. Looking forward to meeting you.
Thanks, Rachel. So now that you've heard a little bit about the hub, as well as ways that we can support you through the RFA process, I'm going to go over some of the evaluation requirements laid out in the RFA in more detail. So first, we'll start out with some of the basic requirements. Beginning on page 11 of this year's RFA, you will see the list of reporting and evaluation requirements for all PPR projects. More specifically, all PPR grantees are required to cooperate with the NTAE and USDA as needed. So this generally means reporting on core, firm, and participant level data, but may also mean meeting with the NTAE or USDA to review project plans or R&E specific protocols or providing documentation upon request. PPR grantees are also required to contribute to the core minimum data set, which includes firm level reporting and participant level surveying annually, which I'll cover in a bit more detail in the next few slides. It is also important to point out that to facilitate firm level reporting, grantees are required to have a data use agreement or MOU with each firm or sub-grantee that guarantees those firms are willing to comply and provide the necessary information for reporting. Lastly, all grantees, as part of the outcome assessment portion of their evaluation, will be required to attain an institutional review board, otherwise known as IRB approval. And this is another topic we'll be diving into a little bit later in today's webinar. Next slide. So now we'll get into some of the more specifics around the evaluation section of your application. Beginning on page 20 in the RFA, it outlines a few additional reporting and evaluation requirements for PPR projects. PPR projects are required to conduct and discuss in your application a process assessment that documents the process, challenges, and success of implementation and operations. A process evaluation may include tracking of milestones achieved along the way, or other simple metrics such as checklists that monitor how your PPR program is being implemented. Were all those components delivered as intended, or other process metrics you might identify? We could spend a lot of time talking about what that self-assessment could be, but broadly it looks at implementation or the resources, inputs, and activity portions of the logic model rather than the outcomes. PPR projects are also required to participate in an outcome assessment that documents the project's effectiveness in improving dietary health through increased consumption of fruits and vegetables, reducing individual and household level food insecurity, and reducing healthcare use and associated costs among eligible participants. A and B will be accomplished through the NTAE core metrics, while C, healthcare use and associated costs, can be achieved through a few different options that we'll discuss in a bit. So next slide. Thank you. Before we dive into the details of the core metrics, I want to take a moment to describe the value and reasoning behind the core metrics that you've likely read about in the RFA and might have explored a little bit further on our website. Demonstrating aggregate program impact of produce prescription projects contributes to the evidence supporting these programs. In turn, this has consequences for policy, funding, and program awareness. Having common core metrics collected across programs allows us to compare apples to apples and to dissect what programmatic features work best under what conditions. The core metrics include both participant level data, which will be done in the form of surveys, and firm data. Firm level data, that is data around sites, characteristics, and incentive transactions. Both sets of core metrics are derived from legislative and RFA language. And in developing the core metrics originally, we weighed these requirements by triangulating what grantees had proposed in their narratives, what programs have collected in the past, the scientific robustness of specific measures, including how well they were tested in low-income communities and grantee capacity. So one of the key components, next slide, please, of the comprehensive evaluation is conducted at the participant level in the form of a survey. The PPR core survey consists of about 30 items with the main goal of measuring fruit and vegetable consumption and food insecurity, along with incentive program use, sociodemographics, and a few other items. This survey is to be collected from the same participants at 2 different time points, both pre and post program. We will put a link in the chat that describes the survey and rationale for each module in more detail, and applicants are encouraged to add additional questions to the participant level surveys if they wish to examine additional impacts of their programs, but these are the minimum set of requirements for the core metrics. Next slide. For produce prescription program participants, we hypothesize that participants of produce prescription projects will see an increase in fruit and vegetable intake at follow-up as compared to baseline intake. Each 2024 produce prescription grantee is required to survey a subsample of 100 to 130 participants over the course of their projects, again at 2 time points, baseline and follow-up, which will look slightly different across projects as the program lengths might differ. To ensure data quality and accuracy, the NTAE is now requiring all GusNIP grantees to use Qualtrics as their survey administration platform. Grantees may use an NTAE-issued Qualtrics account or their own account and choose to collaborate their surveys so that the NTAE is able to access them. This is a new requirement and was put in place due to data discrepancies that the NTAE has encountered in the past. A central platform for all GusNIP surveys will ensure that the required core metrics are set up and coded in a way that are the same across all grantee surveys. And Qualtrics is provided free of charge to all GusNIP grantees. Next slide. So now we're going to turn to firm level core metrics. Another important part of the evaluation are what we call firm level core metrics. These are data reported from firms on a monthly basis and from the grantee and firms on an annual basis. These data will be reported through a secure web-based portal. And again, we'll put the link in the chat with a more detailed information on these metrics. If you're a current GusNIP, GusCRR, or ARPA grantee or a former FINI grantee, these metrics should look fairly familiar to you. Next slide. So now we're going to turn to the healthcare cost and utilization requirement, which you can see on page 20 of the RFA. The first 2 objectives of the GusNIP PPR program, improving fruit and vegetable intake and food security, are assessed through the required core participant survey developed by the NTAE for GusNIP PPR projects. So this leaves us with a third aim, reduction of healthcare use and associated costs. And on the next slide, we'll talk about how program grantees can fulfill this requirement. There are 3 ways to fulfill this requirement. The first is asking participants to self-report utilization using survey questions. And there are a set of questions that have been developed by the hub that we would encourage applicants and grantees to consider using in their surveys. And we have a resource available on the NTAE website to help with this. The second is extracting utilization data from the electronic health record. And the third is accessing insurance claims data. And one thing to note is that EHR data and claims data are likely only accessible to grantees that are health systems themselves or have strong existing partnerships and data sharing agreements with their healthcare partner. And so with that, I'm going to turn it over to Holly Ann to wrap up a few additional items.
Thanks, Ronly. Yeah, just a couple more things related to reporting and evaluation. So GusNIP grantees are responsible for submitting different reports to NIFA and to the NTAE Center. So to NIFA, you will submit the report technical, the report financial, and the SF 425 financial reports. And then separately to the NTAE, you'll submit firm level and participant level data that Ronly just talked about. Next slide. Obtaining IRB or Institutional Review Board approval is the final component of the required evaluation. So as all PPR grantees will be collecting data from human subjects via the survey that's required, IRB is required for all PPR grantees. This doesn't need to happen as part of your GusNIP proposal, but it's a good thing to start thinking about, especially if you've never worked with an IRB before. The NTAE can help guide you in this process following award notification. And Gretchen from my team is going to put a link in the chat about more information related to IRB approval. Next slide. Here we have a timeline to help you see the recommended IRB process starting from the proposal phase that you're in now. And in the proposal phase, and while you wait to hear back about award notification, the most important thing to do related to IRB is to ensure that you have identified and connected with and IRB that you'll work with. Having this connection established sooner rather than later will just make the process much quicker and smoother upon award notification so that you can launch your project and collect data. Next slide. Lastly, I just want to mention that the NTAE recommends adding a line item in your proposed budget specifically for reporting and evaluation, which might include things like IRB costs, an external evaluator, data collection costs, such as participant stipends for completing the survey, among other things. We suggest planning for evaluation to be about 10% of your total budget, but this is going to depend quite a bit on the scope of your proposed project and what you may or may not be doing above and beyond the core metrics. We do have a great resource on our website to help you think through all of the possible costs associated with reporting and evaluation that can help with building out your overall budget. We'll link to that in the chat, and this is also a really great topic for the one-on-one consultation with the NTAE if you have specific questions. Next slide. And here's just another reminder of where you can get in touch with us via email and then on our website where you can find all of the resources that we talked about today, as well as many more. Thank you.
Thank you, everyone.
Excellent
Uh,
questions. We have very
We
many.
have a lot of questions, a very healthy number of questions. I just wanted to clarify that all this information, the recording, the slides, and the resources will be shared through the webpage. So I will be posting that webpage and that you will have all the information there. And Dr. Kennings, you want to go over a few of the questions? There's a very good number of questions here. Thank you, everyone, for that.
Sure. So we have quite a, I think we have 59 or more that we've already answered. So I'll continue to work through the questions submitted in the question answer feature. I will say many of them are on the same theme. So the first theme that I'll go ahead and address is what type of individual or role must an individual have to write a produce prescription? And this is something that there's significant flexibility around. It's important for, for you all and your project teams to determine who might be the best person to write the produce prescription, and to do that in consultation with your healthcare partner. So there is no restriction, from NIFA of who that must be and what role they must hold. What's critical is that as you're putting together your application, your team is determining that with that healthcare partner and healthcare provider. It's if you have a very strong rationale for why that should be some specific other role, please be sure to present that very clearly in the grant application. There have also been many questions around fresh fruits and vegetables, whether legumes can be potentially included among the fresh fruit and vegetable prescription, whether plants or herbs can be included in the fresh fruit and vegetable prescription. You'll see in the project narrative, right, that there's a very specific section where we ask you all to clearly present, right, the selection of fresh fruits and vegetables that are going to be part of that prescription, right, as well as the dosage and duration. And that is where in the grant application, we ask you, right, to really make your case to the peer review panel and present if there are any culturally significant foods that would need to be included, if there are any supply chain challenges that exist in the community to be served, that where you would propose broadening that definition. So please be aware of that. Let's see, what else do we have here? Jamilis, do you have one you want to lift up?
Yes, there is one that is like kind of the first one of this type, and it's about if it could be, can we include budget in a budget line item to pay for participants access to transportation?
So if transportation, right, is critical, right, and necessary for the project, right, if we're thinking about maybe I've seen, right, transportation to and from the clinic, right, or the hospital, absolutely, right, you can very clearly, right, present in the budget the justification for why those transportation services need to be included, and have that be part of the application.
There are a couple of questions about eligibility for SNAP, if it needs to be enrolled, how does that apply?
Yep, so great question. And this is where there's a very clear distinction between what I call the SNAP eligibility pathway, right? And then the medical assistance eligibility pathway, right? So to be an eligible individual, right, we've already talked about the diet-related condition. Eligible for SNAP would be in the SNAP pathway, only eligible. When it comes to medical assistance, right, that person needs to be enrolled. So that's a distinction.
And I have also seen a couple about giving examples of what is a healthcare provider group.
Right. So one of the key things that I'll say items that we've provided clarity to in 2024 is the definition of a healthcare provider group. So any group of 5 or more people that are licensed to provide healthcare, or any group of 5 or more places that are licensed to provide healthcare is considered a healthcare provider group. My apologies. All right, so if you're thinking about whether or not your entity, right, or an entity you partner with meets that definition, that's what you need to be using in your own conversations, right? So if that organization is licensed to provide healthcare, right, and it has 5 or more people who are licensed, or on the whole has 5 or more places, then that would be an organization that is a healthcare provider group and can fulfill that healthcare partner role. I've got another question here about our applicants expected to do their own sourcing of the fresh fruits and vegetables for the fresh fruit and vegetable prescriptions. And yes, the sourcing plan for the fresh fruit and vegetable prescriptions that will be redeemed should be part of the grant application, whether that's a role that the primary applicant is going to play, or a role where there's going to be a partner and collaborator. And there's a lot of flexibility, right? Perhaps that partner and collaborator is a retail location, perhaps it's a farmer's market or a direct relationship with a farm. There's lots of flexibility. And to answer the question, yes, the sourcing and availability, right, of the produce prescription, fresh fruits and vegetables for, right, in the amounts prescribed, right, and for the duration of the prescription should all be clear in the grant application. Excellent question.
There's another question. Does the tribal applicant need to provide documentation?
If this is a tribal government or a nonprofit organization that's a tribal organization, no, there's no additional documentation that's required. It would be the same as any other type of governmental agency applying, right? Your organization information itself from the SAM registration and grants.gov registration that describes your organization is sufficient to making it clear that you're eligible to apply, right? That there's only that nuance for institutions of higher education. So I hope I understood your question correctly. If you're from, let's say, a tribal college or university, right, that is an institution of higher education, as opposed to a tribal government organization, then that organization would need to follow the expectations of the institution of higher education. So if this needs to be something that we discuss on an individual basis, please go ahead and email me directly and we'll get it sorted out.
There's another question is, does GusNIP grant provide the funds needed to do all the legwork, relationship building, and program design for such PPR project? Or do they need to fund the pre-work and the designing?
Would you repeat that, Jamilis? Relationship building and what else?
Program design for that same project.
Okay.
This is the pre-work of the project itself.
Yeah. I will say that it's quite common in the produce prescription field for there to be a period of time early in a project where you're working with your community and the community assets to build out the framework for the full what the full produce prescription intervention and project might look like. So certainly in those cases, having that developmental phase as part of the overall project plan is certainly acceptable. I recommend for applicants that you provide the peer review panel with a solid framework of what you might anticipate, Maybe you don't know exactly what the end result might be, but perhaps you can share, a menu that would be really helpful. I will also say it's critical, that healthcare partner already be known, and already be a member of the project team prior to application. Otherwise, the proposal won't make it past the initial screening.
There's another question here. Is there a requirement of a minimum number of participants in the produce prescription?
I would recommend that if you're looking for a minimum number of participants, that you look toward the sample size for the comprehensive evaluation. If you're needing a numerical guide, I will say that you're welcome to reach out to me, reach out to Dr. Grimes if you want to have a more detailed conversation. It's rare that this grant program receive proposals that would serve fewer than 100 or 150 participants.
There is a lot of more questions, but we are almost 15 minutes over the time, and we want to respect the people's time. So we can, would you like to continue answering a few, or we can also answer these questions through the website and the resources and have a Q&A, frequently asked questions document with including the questions that were here shared in the webinar.
Yes, Yamilis,
it.
I think that's
Okay.
excellent. We will make sure that all of the questions that you all have submitted today, either in the question and answer feature or in the chat, that we review them, and we will ensure that they are answered on that frequently asked questions webpage for produce prescription that I know Yamilis has already shared in the chat. So we will be sure to get you all the clarity you need. Thank you so much for your time today. Thank you to our captioners. Thank you to our interpreters. We so appreciate your time and your talents. Thank you so much to our NTAE partners for being with us.
Thank you, everyone.